Welcome, everyone. Thank you for joining us. I'm Sara Payne, Vice President of Inprela, a healthcare communications firm. COVID-19 will bring a lot of change to our world. I've been sitting down with Payne leaders to talk about its impact on the future of health insurance. Joining me today is Dr. Tara Bishop, Chief Clinical Officer at Payne. Hello, Tara.
Hi, Sara. Thanks for having me on.
Yeah, thanks for joining me. Before we dive in, Tara, I wanted to acknowledge the fact that you're a physician living in New York, and I can only imagine what it's been like to watch your city's way of life change nearly overnight, and for you to be watching your colleagues on the front line working so hard to save lives. Can you tell us a little bit about what that's been like?
Absolutely, Sara. So thank you first for acknowledging that this is both a life-altering and unique situation that none of us have lived in. I have practiced in New York for almost 20 years. I was a fourth-year medical student during 9/11. I lived through a massive hurricane that flooded several of our hospital systems, but I've never experienced anything like COVID-19. I think from what I hear from friends and colleagues on the front line, it's both a very scary time for some of their themselves when they're worried about personal protective equipment, but also just the way that hospitals have had to transform and how most of the care now in New York City in hospitals are purely based on COVID, lots of people on respirators, and unfortunately lots of death. So we are very grateful for the work that all of our colleagues are doing. And it's, I think, touching everyone in New York very deeply.
Yeah, for sure. Well, thank you for commenting on that. I, wanted to acknowledge it, and I just know that it's your frame of reference for the conversation today. So, the first thing that I wanted to talk about is, of course, all of this change is going to have an impact on health insurance as well. And I wanted to ask you, has Payne made any changes in its plan design in response to COVID-19?
I can talk a little bit about what Payne has done, but I also want to just acknowledge that COVID-19 has had dramatic change in healthcare, as I mentioned, more than any event that I have ever known during my career. And we've had to both make adaptations, but also have leveraged a lot of our existing plan design. Just to take you a little bit back, the way most health plans are designed, things like a hospitalization or an emergency room visit can cost members and patients thousands of dollars, and often those bills and what that costs to them would only come out once they got those bills coming in their door. Nowadays, we have lots of plans that are considered high deductible plans, so a patient may have to pay thousands of dollars before their health coverage even kicks in. And even if you don't have a high deductible plan, it's very unclear sometimes how much things will cost. I'll give you just a simple example from my own experience. When I have several sons, I have 3 sons. Several years ago, I brought one of them to an urgent care center, had no idea what the cost of that care would be. I was not under the Payne plan at that time. And I remember getting a bill from an unknown lab because a strep test was sent to them. And some unknown number of dollars that came out of that lab I had to pay. It was very confusing and opaque to me about why and how much I had to pay those amounts. And I think it just highlights some of that uncertainty that we all have around medical bills. With Payne, we actually very deliberately don't want that to be the case, and we've designed our benefits so that people know how much things will cost them before they walk in the door. And I think that's been actually very valuable during COVID. A few things that I think are very unique about the Payne plan that didn't have to change is the fact that we do have clear copays for any kind of service that you need. So if you go into a doctor's office or you go into an emergency room or you get hospitalized, those costs are very clear to you before you actually walk in the door. But there are actually things that are even more specific to COVID that that we have seen other plans have to change and Bind has not had to change. The first thing specifically is around testing. So there was a lot of discussion early during the COVID-19 pandemic around how much would the diagnostic test for COVID cost? And would we be able to stop, to waive the cost sharing for that service? Many plans actually needed legislation and had to completely change the way they covered those benefits. Fortunately, with Bind, we've actually created lab testing and other testing, such as x-rays, as a $0 copay for our members. And as a result, we didn't actually have to change anything about our benefit in light of COVID. Now, there have been a few changes that have come out through legislation. There was a recent act called the CARES Act that changed the requirement around diagnostic tests and, diagnostic visits, and required that diagnostic visits. So if you're going into the doctor's office or you're going to an urgent care center for testing or checking out for COVID, that will be covered with $0 copay. And that was a change that we made in response to the legislation. But again, the testing was all part of our kind of natural Bind benefit.
What you said on the front half of that, Tara, really resonated with me. Deliberate plan design to protect members from surprises. I mean, that's just so amazing and I think so unique for Bind. And then the fact that because of that, really, you've had to make minimal plan changes here in light of COVID, which again is just fascinating to me. Let's talk a little bit about what's changing in terms of how people are seeking medical care and the types of services being consumed right now during this time.
Yeah, great question, Sarah. As I mentioned earlier, I'm a doctor. I've been practicing in New York City for almost 20 years. And through multiple other crises, I've never seen such a seismic change in healthcare as I'm seeing with COVID. And I'm both proud and humbled by the way the health system has responded. I mean, honestly, things like virtual care, dramatic shifts in hospital care, dramatic shifts in canceling elective surgeries are things I never would have even thought possible until you actually see a crisis like COVID. So I'm happy to tell you a little bit about what I'm seeing now in terms of what's happening immediately in the healthcare system to change. But I also think there are things that are going to change in the horizon and that we actually have to be very aware of. The first thing is virtual care and the dramatic shift of in-person care to virtual care, either by video conferencing or by telephone. There has been, I think, a growing understanding around the need for virtual care, but not really the kind of change that we anticipated. In fact, in 2013, I actually did a study with a number of colleagues when I was a professor at Cornell, where we actually looked at the trends in virtual care and actually spoke with health plans around their coverage and their shifting toward virtual healthcare. And it seemed to actually not be on people's radars. Since that time, there have been a number of companies that have evolved and are delivering that service, but it still is not the norm in the healthcare system. In COVID-19, we saw within a matter of days to weeks, massive shifts of care being transferred from in-person to virtual. There are some studies that have come out from UCSF. There are studies that have come out from Harvard that show within a matter of days, care that was being delivered in the office was now being delivered virtually through apps, through websites, through video conferencing, and those kinds of means. So again, I personally have never seen such a dramatic change in the way we deliver care as I have seen with the virtual care movement in COVID. The other thing that has dramatically changed, and I think this is more of a real-time change and probably just in response, I think we will likely move back to more traditional care in this sense, is how hospitals have transformed themselves. Living in New York and knowing that New York healthcare system, we've seen things like massive Navy ships coming in to house patients. I walked by Central Park the other day and saw massive tents across from Mount Sinai Hospital there to deliver care for patients. Hospital for Special Surgery, which is a hospital down the street, has transformed all of their elective care and all their ICUs into beds for COVID. So this ability to kind of flex and change, again, a massive change in how we're delivering care. And as a result, we've been able to expand our ventilator and bed capacity beyond, I think, what anyone even imagined. And then the last thing that I think, the last trend that I'm seeing is that in the same way that virtual care changed so quickly, there was a rapid change to essentially stop all elective care. And again, I've never seen anything so dramatic in my career. We both through legislation, but also through hospitals making decisions to say it's not actually a safe time to do elective care. Let's not do elective surgeries right now because we don't want to use up the healthcare resources, but we also want to make sure that people are safe. So this dramatic shift in moving all care to urgent and more emergent care, whether it's in hospitals or even in ambulatory surgery centers and other kinds of places of service, is something like I've never seen before in my career. So again, these are kind of three, I think, immediate things that we are seeing right now. I'd love to touch on a few kind of future things. In my role at Bind, one of the things that I do focus on is making sure that we're prepared to address the future needs that may be coming through the pipeline. And there are probably three things that are on top of mind for me. The first is a growing need, and probably an even growing need over the next weeks to months, for mental health care. And we're working to do a lot of things to ensure that mental health care access is available to our members. We have virtual mental health care through several providers of that care. We are looking to see what other kind of brick and mortar providers are doing to shift to virtual mental health care. And we have a clinical advocacy program that is staffed by mental health specialists to help members navigate that very difficult benefit, but also in a very difficult time. So that's a real focus area for me. The second is we know that with all these changes in elective surgery, that there will be a rapid need to an increase in a lot of deferred care later on in the year. And we're already hearing reports of waiting lists for things like cancer surgeries, and people having discussions about when will they have that knee replacement that they had been planning in April. At what point will that actually start to happen? And I anticipate that as COVID care starts to diminish and we start to get back to a level of normalcy, the healthcare system will have to absorb a lot of that deferred care. The deferred care has been things like elective surgeries, but it's also been things like routine preventative care, even infusions and injections that people just don't want to have right now, given the uncertainty of the healthcare environment. So I think later on in the year, that's something we're watching, is what is a trend that's happening in deferred care. And then the third thing that I think is something that is going to come, I think, have a longer impact on the industry, is this rapid shift to virtual care. And I think a realization by the healthcare community that a lot of care actually can be delivered virtually and not in person. And that patients actually might prefer that. It may save them a visit to the doctor's office. It may save them time. And I think this is a time period where we've seen sort of the opportunity for virtual care. And I think that's going to be a larger trend that will continue. There was an interesting data point that from UCSF where prior to this, about 2% of their visits were virtual. Now well over half of their visits are virtual, and they don't think they're going to go back to that 2%. It's going to stay higher than that. And I think that's certainly going to be the case. So one of the things that we're at Bind that we are working on is making sure that we have the coverage and the benefit available for that virtual care.
Wow, so many great insights packed in there, Tara. One thing I wanted to comment on first was just you were talking about at the beginning all the dramatic shifts that we're seeing right now and how care is being delivered that happened nearly overnight, which for me, it's like the fact that we can make a change. I think in an industry that has long struggled with change, adapting to change can be hard. I think gives us all a little bit of hope that we're resilient. I think we're more resilient and innovative and flexible as an industry than maybe we thought. And so that to me really stood out. And I love that, you're in a specific role. You're in a unique position, Tara, where you really are being reflective, both on the current reality, but then being reflective and futuristic around how can we prepare and how can Bind as an organization make sure it's helping customers prepare. Obviously, a big role, but it looks like you're tackling all the important areas. And I'm glad that you mentioned the growing need for mental health care, because you're right. We're hearing a lot about how important that is going to be here moving forward. Anything else you wanted to comment specifically around mental health in terms of how that care will be delivered moving forward, or what that should look like to make sure that people are able to get the services, the therapy that they need?
Great question. And mental health care, Sarah, has been one of my passions for years. When I practiced primary care, I'm finding referrals for psychiatrists and psychotherapists was by far the hardest thing for me to do. And I actually did a number of studies and work in this area that quantified the lack of access to mental health care in this country. It's really staggering at times to think about how hard it is to get mental health care. And so as a result, even before COVID, the focus on finding better ways to access mental health care has been something that we have thought about at Bind and are building capabilities. I think COVID-19 has made that need just a little bit more urgent. We really do need to get these resources available. What I'm optimistic about is that idea that virtual care is becoming more and more of a norm in a very short time period. I think there's a ton of opportunity to think about digital solutions for mental health care, whether it's direct virtual psychotherapy sessions, whether it's longer term cognitive behavioral programs, and that shift and that ability to innovate in that space, I think is going to happen faster and with more innovation, given what's happening with COVID-19. So I am optimistic that this actually is helping us to think about new ways to deliver mental health care. And it's helped us kind of think about how to accelerate what we're doing at Bind to identify some of these newer providers, these different programs, and thinking about how we use all of our resources to help members navigate that care.
Are you seeing signs, Tara, that there's a growing sense of urgency for new insurance design?
Yes, in some ways. I think in general, there's always been an urgency for a new insurance design. When I first started practicing medicine, the idea of cost, quality, value in healthcare was really in its infancy, and we were just at that time starting to get reports on poor quality care, rising healthcare costs, and of course at that time the uninsured was a big substantial problem. On the ground, I was seeing tons of problems at that time. People coming back to the emergency room after being there 2 days beforehand, lots of unnecessary tests and procedures, and a lot of people living without really adequate coverage. Fast forward to now, a ton has changed. And so I would say in the last 10 years, even most substantially, there's been a really big shift to move from what we call fee-for-service healthcare, which is, paying for all the things that people do rather than paying for the quality or the value of that care, to really more of a value-based payment situation where we are paying providers and doctors and hospitals differently. And prior to joining Bind, I spent a lot of time actually working to develop some of these programs and to evaluate some of these programs. Throughout that time, though, one of the missing links was always, in my mind, the consumer and the member, the person who's actually consuming healthcare. So a lot of the efforts that have come into place in the last 10 years was, how do we pay doctors differently? How do we align those incentives? But one of the things that was lacking was that, again, member or consumer connection. And so that's actually really why I joined Bind, is I felt there was a tremendous amount of opportunity to align the incentive for the consumer, the patient, to make sure that they understood not just how much things cost, but that we were able to tie the cost of that care to the relative value. So something that could save a life, something that could make a much better quality of life and had really good outcomes should, in our minds, should cost less to the consumer, whereas something that's less proven or overused in a lot of ways or not really necessary could have a higher price tag. And so I think the need for different insurance design has existed for many, many years. I think what's interesting about COVID and being in this situation is just that we have the potential to do a lot of change. As I said, we've seen so much change in the healthcare system rapidly happen in response to this. And it makes me optimistic, as you said earlier, that, we live in an industry that is hard to change and slow to change, but we've been able to see COVID drive a lot of that when it's necessary. And I think the same case is true for insurance design.
Excellent. I know we're almost out of time, Tara. I did want to ask one final question. We're all going to walk away with a new perspective on the healthcare system through all of this. How do you specifically hope that COVID-19 shapes the future of our healthcare system?
So first of all, I need to kind of thank and honor all the frontline providers and healthcare workers. I have never seen healthcare workers, including many of my colleagues and friends, really step up the way they have stepped up for COVID. The firsthand accounts are sometimes harrowing, and yet people are on the front line. And I think it just demonstrates the power and of people getting up and stepping up and working together. And so that makes me very optimistic about the future of healthcare in general. I think it's going to make us realize there are things we're never going to want to ever let our healthcare system do again. Things like not having enough protective equipment for our healthcare workers. We'll never want to live in a time where people can't visit relatives in nursing homes. We're going to never want a time where people have to die alone in the hospital. And I think in many ways it was just a wake-up call of sort of how awful it can be if things get out of control and as bad as they have been right now. But as I said, it also brings me a lot of optimism. I have never seen our healthcare system really step up and rise to the challenge as I have seen with COVID. Changing the way we deliver care, putting the patients first, changing legislation so that people can get the care that they need. And being really innovative very quickly to respond to this. I think it's made us all start to think about what can we do with healthcare if we continue on that trajectory of working together, rising up to challenges and finding innovation and all of that. So I think when all of this settles, we'll be more knowledgeable about what we're capable of doing. And I think we'll be able to accelerate a lot of the innovation that has perhaps not had that push or that impetus to accelerate to different levels. So again, with a lot of respect for all the things that people are going through right now, and hard times at the moment, I am optimistic about change and improvement in our healthcare system.
I really love that, and it certainly makes me feel optimistic as well. Thank you so much, Tara. I've really enjoyed our conversation today, and thank you for sharing your perspectives with us.
Thanks so much, Sarah.
To our listeners, thank you so much for joining us. Stay well.